President Muhammadu Buhari recently signed the Mental Health Bill 2021, replacing the Lunacy Act of 1958. How significant is this mental health bill in addressing mental health care in Nigeria? Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
You know this moment. Well, forget all that. Get out on that skateboard from 10 years ago. Break out that lucky bat. Do that. Do it badly, do it awkwardly. Do it your own way. The point is, get moving. For you and your health. Yeah, that'll do it.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Aina Oyekanmi, Chief Consultant Psychiatrist with the Federal Neuropsychiatric Hospital Aro in Abeokuta, and she's going to share her expertise on the newly signed Mental Health Bill 2021. Good evening, Dr. Oyekanmi, and thanks for obliging us.
Thank you. Good evening.
All right, Dr. Oyekanmi, about 80% of Nigerians cannot access mental health care needs. Let's put mental health into perspective. How significant is mental health?
Mental health is a necessary state of health that everybody must have, because it's your mental health that helps you to be able to be functional as a human being. I mean, we make choices and decisions every day, and you need to think, you need to have the right emotions, your behavior must be in order for you to do the right thing. It's your mental health that you use to cope with changes, or to adapt to changes rather, and to cope with adversities. It's your mental health that helps you to relate well with other people. So mental health is very, very important. And there's nothing, absolutely nothing anybody can do without his or her mental health. Even as a broadcaster, you as a broadcaster, you need your mental health. Myself as a psychiatrist, I need my mental health. The pepper seller needs her mental health. The carpenter, the business executive, everybody, whether you are the public or private sector, whether you are an adult or you are a child, you are a student, you are a worker, whatever you do in life, you need your mental health. So mental health is all important. And that is what helps us to function as people, as human beings, rather.
Dr. Oyekanmi, are there types of mental health illnesses?
So when we say mental illness is not madness. So there are different types of mental illnesses. Let me just mention some of the commonest ones. So we have things like mood disorders, which include depression, bipolar affective disorder. Depression, everybody knows about depression. But let me highlight that because depression is one of the commonest type of mental illness, depression is not the same thing as sadness. So depression is when you experience sadness that cripples you, that affects your functionality. It is a normal thing to be sad at some times, but when it begins to affect your enjoyment of life, when it begins to affect your functionality, then it is no longer normal sadness. It may be depression. So you need to talk to a doctor. Another common mental illness is anxiety disorders. You can have generalized anxiety disorder. You can have phobia. You can have different types of anxiety disorder. So if you see that maybe you are just afraid, you can't pinpoint what you are afraid of, or you're afraid of certain situations, which we call phobia, please see a mental health doctor. Another one that we need to mention is substance abuse. Substance abuse, which people call addiction, is a very common mental health disorder, and help is available, please. So if you know anybody that is abusing drugs like cigarettes, alcohol, marijuana, cocaine, sniffing glues, sniffing petrol, sniffing household solvents, please encourage that person to come for treatment. Then we also have mental illnesses like schizophrenia. Schizophrenia is a psychotic disorder in which the person loses touch with reality. So if you see somebody who you ask A and is telling you B, whose thoughts are not coherent, it may be that that person has a psychotic disorder, or somebody that is talking to him or herself, or somebody that is laughing to something that is not funny. Please ensure that the person is taken to the doctor for prompt treatment. We also have personality disorders. So there are many other types, but these are, fairly common mental illnesses that adults can experience. Then in children too can experience mental illnesses, because a lot of times people think that, oh, they are children, what are they thinking about? They also have minds, even though their minds are developing. So children can also have all of these conditions that I have mentioned. Children too can have depression, they can have bipolar illness, they can have anxiety disorder, they can have substance abuse disorder, they can have conduct disorder. So for example, when you see a child that is just rebellious, or a child that is lying or stealing, it may be that that child has what we call conduct disorder. Please bring that child to the hospital for an evaluation. Also, children can have what we call neurodevelopmental disorders, and this includes things like autism. Autism is very common, and when a child has autism, you might notice that the child does not like to interact with people, may not like to interact with the parents or with his peers. The child might not look into your eyes. The child might not talk when the child is supposed to be talking. So if you see any aberrant thing, anything that you cannot explain in any child, please don't wait. Don't say that, oh, the child is going to overcome it, the child is going to grow out of it. It might be a mental health condition. Another thing that I need to mention, which is very important in childhood, is epilepsy. Epilepsy is very treatable. Epilepsy, we have different types of epilepsies. It is not only the convulsive type. The convulsive type is the one that the person would fall down and be shaking. We have different types of epilepsies. So anytime that you notice that any child or adult is behaving abnormally, don't just dismiss it. It might be any of these conditions that I have mentioned. Please ensure that the person is brought to the hospital. Help is available. Many of these conditions can be treated.
All right, let's fully assess mental health care in Nigeria.
You see, because mental illness carries a lot of stigma and discrimination, most of the time when people develop mental illness, they don't come to the hospital. They don't go to the right places because they feel ashamed. So they try to manage it in secrecy. And then because the understanding about mental illness is not so deep in this part of the world, a lot of times people still think that mental illnesses are caused by a spiritual attack. So when they have symptoms suggestive of mental illness, they would rather go to prayer houses, maybe to see their pastors, to see their imams, to see clerics. Some would go to the traditional herbalists. They would not come directly to the hospital. Most of the time, by the time we are seeing patients in the hospital, they would have wasted a lot of years. Some would come after like maybe 5 years, 10 years after the illness started. And you know that when an illness starts, the earlier you intervene, the better the outcome. So because of this stigma and discrimination, a lot of times people do not come on time to the hospital. And even for some people that know outrightly from the onset that it is mental illness they have, some of them don't even know where to go. They don't know where to go. So we have a problem of stigmatization and discrimination, and we also have the problem of people even willing to come for treatment, but they don't know where to go. Why? Because we don't have enough mental health care in Nigeria. As you know now, a lot of doctors have left the system. So we even have fewer psychiatrists now. That is what is happening currently now. So you can imagine what is going to happen in maybe 1 or 2 years if nothing is done about this brain drain.
Dr. Oyekanmi, with the health challenges you just highlighted now, how do we overcome this challenge? How can we change the narrative before we look at the mental health field?
We can change. There's nothing that cannot be changed, because most of these problems are caused by man, right? So, but we need to start from a place of education. We need to do a lot of massive education so that people would understand when we say mental health and mental illness. People need to know that mental illness is not all about madness. And I am emphasizing this because it is very, 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 very important. When people see mental illness, like every other bodily illness, they would come to the hospital, they will go to the right places. When they see mental illness like hypertension, diabetes, arthritis, any other bodily illness, then they would come to the hospital. So education is very, very important. Education, and education. This is what is going to reduce the level of ignorance.
Is there any legislation act for mental health in Nigeria, Dr. Oyekanmi?
Yes, we have a new legislation now. We have a new mental health act. The one we had before was called the Lunacy Act of 1958. And even from the name alone, lunacy is a word that was taken from Luna. Luna means the moon. And it was thought at a time that mental illnesses are caused by stars, moon, the movement of moon, the movement of stars, magnetic fields. So lunacy means something that has to do with the movement of the moon. So before, mental illness was addressed as lunacy. But with the evolution of medical science, with the evolution of neuroscience, we know that mental illnesses don't have anything to do with the moon. Therefore, that Lunacy Act cannot work. It is obsolete, it is old, and it is discriminatory and derogatory. Fortunately, now President Muhammadu Buhari has signed a new mental health bill into law. So we have a brand new mental health act, which is going to revolutionize the way people view mental health and illness. And this is a good step in the right direction. So we have a new mental health law now.
Now, what makes the bill different from the old Lunacy Act of 1958?
Very well. It is going to address two fundamental issues, right? Number one, it's going to provide a unified response, a unified strategy, a unified approach towards mental health and illness. That's number one. Number two, the bill is going to ensure the rights of the mentally ill. Now, before in the Lunacy Act, the rights of the mentally ill were trampled upon. People would just take them away from the street and just put them in a place. And at that time, the focus was just on custodial treatment, meaning that, let us just put these people in custody so that they don't become a nuisance to the environment. That was at that time, during the time of this Lunacy Act. So the new bill is going to ensure that the rights of the mentally ill is enshrined, it is upheld. Now, to achieve this, the new bill sets up three structures. So now we are going to have a mental health department in the Ministry of Health. Number two, we are going to have what is called a mental health fund. Number three, we are going to have what is called a mental health committee. So we have three structures that is going to help in revolutionizing how we see mental health and illness in Nigeria. So the number one structure, mental health department, what are they going to do? They are going to be the ones that would implement all the provisions of this new law. They are also going to formulate policies, and they are going to seek approval for these policies. Then they are also going to support research. They are going to facilitate research. They are also going to uphold people's mental health. How do I mean? This mental health bill is not only for the mentally ill, it is also for every Nigerian. So this mental health department in the Federal Ministry of Health now is going to come up with programs, is going to facilitate ideas, that is going to promote the mental health of all Nigerians. So it means that they are going to do things that we call preventive mental health care. So they are going to begin to do programs that would even prevent mental illnesses from occurring in the first instances. So that means they are going to educate people massively so that people would know what to do to keep their mental health. They are also going to target people that are at risk of developing mental illnesses. For example, people that have experienced disasters, for example, people in the IDP camps, people that have experienced disasters like flooding, out of school children, any form of trauma, people that are at risk, people from dysfunctional homes. So we would see a lot of mental health education. We will see a lot of mental health education in corporate places, in schools, for example, drug clubs that would educate students about how to maintain their health, how not to do drugs so that they will not damage their mental health. So this department is not only focusing on the mentally ill, it is also going to do things that will promote the mental health of Nigerians. Then the second structure set up by this mental health bill is the mental health fund. Now, this is like a purse that will facilitate all the objectives of the mental health bill. As you know, we need money for everything. So this mental health fund is going to ensure that money is available to facilitate everything that the mental health department is going to do. And then the third one, the mental health committee, is going to ensure that the rights of the mentally ill are not trampled upon. So, for example, if a mentally ill patient was abused, maybe at work or in the neighborhood or by anybody, the mentally ill now has a place to go to. He can appeal to this committee and they will take up his matter. So henceforth, nobody can abuse a mentally ill. Therefore, all these treatment centers that beat mentally ill patients in the name of, if they flog them, the evil spirit will leave them. They would now be prosecuted because it is no longer available for you to abuse, to mistreat, or to malhandle anybody because that person has mental illness. Mental illnesses are biological illnesses. They are like hypertension, they are like diabetes. So they are legitimate medical illnesses. So this mental health bill, if it is implemented, is going to help us a very, very great deal. We are going to see new things.
It is one thing to sign bills into law. How do we ensure full implementation of the mental health bill in Nigeria?
Nigeria has a lot of beautiful things on paper. We have a lot of ideas on paper. One problem we have with Nigeria is implementing, policies, implementing things that have been planned for. So, I mentioned that this bill also provides for a mental health fund. Unfortunately, this mental health fund is not like the TED fund. The TED fund is like a mandatory type of fund wherein companies are mandated legally by law to remit part of their profit into a purse, which is called the TED fund, or that would fund what is called the TED fund. But for mental health fund, we don't have such. The mental health fund is going to rely on donations, voluntary donations, and budgetary allocations. That is, however or how much the National Assembly passes. So in a way, the mental health fund is not something that is statutory. I mean, in the fact that it has not mandated any company or anybody to put money in there. And so if there is no fund to drive all these objectives, it will just remain on paper. So I see that a major challenge is going to be actually funding these objectives. One major challenge is going to be that. Then number two, another challenge that we are going to have is that when we now start educating people and people start realizing that their mental health is important and they start accepting the fact that mental illnesses are biological illnesses, and they now start coming to the hospital. Where is the manpower? Remember, I highlighted the fact that we have a lot of brain drain. A lot of doctors have migrated out of Nigeria. A lot of psychiatrists have left the system. So when we are overwhelmed by patients, what do we do? What do we do? How do we handle that massive turnaround, which is what we want? We want patients to come to the hospital. We want them to come for the right treatment, but we don't have enough manpower. So that is going to be a challenge. And then number 3, we know that mental illness is still not fully covered by insurance. So when patients come to the hospital, they have to pay from their own pockets. And we know that a lot of people are poor. So how are they going to pay for the treatment they are coming to receive? How? However, in the mental health bill, I must mention that the mental health bill also makes provision for mental health care at every public health facility in all levels. That means now we are going to have mental treatments, mental health care in primary levels, in secondary levels, and in the tertiary levels, meaning that in primary health care, closest to your place where you live, you should be able to receive mental health care there. Then in the tertiary hospitals and in the secondary hospital, like in the general hospitals. So for the law is stipulating that there will be mental health care in every public healthcare facility. So I go back again to primary healthcare facilities. Where are the doctors that would man these primary healthcare facilities? Where are they? They are simply not available. That is going to be a major challenge. That is going to be a major challenge.
Dr. Oyekanmi, that's on a national level. Now, how do we ensure states domesticate this law?
Everything, I like it that, we are getting it right at the national level. And we know that anything that the head gets right is going to trickle down. So I foresee a situation where each state would also, emulate what is happening at the national level. I think the national level will be like the leader in this new movement. And I think that it will trickle down. It will trickle down into the states and local government level.
Are there tips to ensure one's mental health is improved?
So there are many things that people can do to facilitate their mental health. Number 1, they must understand the right things about mental health. When we say mental, we mean the mind. And the mind is in the brain. Your mental health comes from a biological organ called the brain. The brain is in your head. Your mental health doesn't come from outside of your body. It comes from your brain. So number 1, eat well to nourish your brain. The same way you eat well to nourish the other organs in your system, the same way, eat good food to nourish your brain so that your brain will serve you well. Number 2, sleep well. Sleep is very, very important. Sleep is a very, very important mechanism to boost our mental health. When you're supposed to be sleeping at night, don't be on your social media. Sleep well. Number 3 is that surround yourself with positive people, people that can encourage you, people that you can talk to, because we are social beings. We are wired to be social. We are not wired to live life in silos. We are not wired to live life by ourselves. We need one another. So social support is very, very important. So make sure you support yourself with the right set of people. Support yourself with positive people. Number 4 is that you adopt a healthy way of thinking. Think positively. Your brain is an organ that you can calibrate. Your brain is an organ that you can fine-tune it into a way that it will serve you well. So let your thinking be deep. Think positively. Look outside the box. For example, 2 people might be going through the same challenge, and one is able to think outside the box. For somebody who is able to think outside the box, meaning that the person is able to think holistically, the person can even come up with ideas from that same challenge. And somebody that is narrow-minded would only focus on that problem, and the person can even have a mental breakdown. So it's important that we learn to think positively. We learn to look at situations holistically. Number 5 is that you manage your time very, very well. Time management is very, very important. And a lot of people don't manage their time very well, and it puts unnecessary pressures on them. So you prioritize your activities. You do the important things first, and don't do the less important things first, so that you would have more time to do the important things. Another thing is that, number 6, is that people should make time for relaxation. Relaxation is very, very important. And learn how to manage stress. There are different stress techniques, and there are plenty on the internet. So check them out online. You can do deep breathing, you can do massage, there is visualization, there is meditation, there is mindfulness. There are different types of stress management techniques. So you look at the one that works for you. And let me also highlight that if you do all these self-help things, and you are still experiencing difficulties with your mental health, please don't self-medicate. Go to the right places. Go to the hospitals. Help is available.
Mental health is not madness. Do not self-medicate. Dr. Aina Oyekanmi, Chief Consultant Psychiatrist, Federal Neuropsychiatric Hospital Aro, Abeokuta. Thank you so much for your time and expertise on the program. We really appreciate you.
Thank you.
Sound Health continues with trending health report from around the world. Please stay tuned. There is no shame in taking care of your mental health care needs. Do not self-medicate. Call 767 or 112. You can equally visit the nearest health facility for all your mental health care. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.